The patient should be seated quietly for at least 5 minutes in a chair with the back supported, with their feet on the floor and their arms supported at heart level. The patient should refrain from smoking cigarettes or ingesting caffeine for at least 30 minutes prior to the measurement. Measuring supine and standing values may be indicated under special circumstances. You wrap the cuff firmly around the upper arm at heart level, align the cuff with the brachial artery. The appropriate cuff size must be used to ensure accurate measurement. The bladder within the cuff should encircle at least 80% of the upper arm. There are different cuff sizes, so be sure to get the appropriate size for your patient. Place the stethoscope chest piece below the antecubital space over the brachial artery. Bell and diaphragm side of chest piece appear equally effective in assessing blood pressure. To close the pump, firmly rotate the knob to the right. Quickly inflate the cuff pressure to 20 millimeters for mercury above first Korsakoff sound. Slowly release pressure at equal rate to 2 to 5 millimeters per mercury. The systolic blood pressure is the point at which the first of two or more Korsakoff sounds is heard, and diastolic blood pressure is the point before the disappearance of Korsakoff sounds. At least 2 measurements should be made and the average should be taken. Blood pressure should be measured in both arms during the first exam. The systolic pressure is the highest pressure during contraction of the heart. The diastolic pressure is the pressure in the arteries between heartbeats when the heart muscles are relaxing and refilling with blood. There are 4 categories to determine blood pressure. The first one is normal with the systolic of less than 120 and diastolic less than 80. Prehypertension has a systolic 120 to 139 or 80 to 89 diastolic. The hypertension are in 2 stages. The second stage being 160 or higher or 100 diastolic or higher.